Imagine feeling excruciating pain every month. Pain so severe that it disrupts your daily life, yet no one seems to understand what you're going through. This is the reality for millions of women around the world who suffer from endometriosis. Despite its prevalence, endometriosis remains one of the most misunderstood and underdiagnosed conditions. Let's delve deeper into this complex disease, exploring its causes, symptoms, diagnosis, treatment options, and how it impacts the lives of those affected. What is endometriosis? Endometriosis is a chronic medical condition where tissue similar to the lining of the uterus, known as the endometrium, starts to grow outside the uterus. This tissue can implant itself on the ovaries, fallopian tubes, outer surface of the uterus, and other organs within the pelvis. Unlike the endometrial tissue that sheds during menstruation, this misplaced tissue has no way to exit the body, leading to inflammation, pain, and the formation of scar tissue, also known as adhesions. Causes and risk factors. While the exact cause of endometriosis remains elusive, several theories have been proposed. Retrograde menstruation. This theory suggests that menstrual blood flows backward through the fallopian tubes into the pelvic cavity, instead of leaving the body, allowing endometrial cells to implant and grow outside the uterus. Embryonic cell. Transformation hormones such as estrogen might transform embryonic cells into endometrial-like cell implants during puberty. Immune system disorders. Problems with the immune system may make the body unable to recognize and destroy endometrial-like tissue growing outside the uterus. Genetic factors. Endometriosis often runs in families, suggesting a genetic predisposition. Risk factors include never giving birth, starting menstruation at an early age, going through menopause at an older age, short menstrual cycles of less than 27 days, heavy menstrual periods lasting more than 7 days, low body mass index, alcohol consumption, and a family history of endometriosis. Symptoms. The symptoms of endometriosis can vary widely. Some women experience mild symptoms, while others suffer from severe pain and complications. Common symptoms include pelvic pain, often the most debilitating symptom. This pain can occur before and during menstruation, during or after sexual intercourse, during bowel movements or urination, and can also be chronic. Menstrual irregularities. Heavy menstrual periods, also known as menorrhagia, or bleeding between periods, known as menometrorrhagia, are common. Infertility. Endometriosis is found in 20 to 40% of women who are infertile. Other symptoms. These can include fatigue, diarrhea, constipation, bloating, and nausea, especially during menstrual periods. Diagnosing endometriosis can be challenging due to its varied symptoms and overlap with other conditions. Diagnostic methods include pelvic exam. A doctor feels for large cysts or scars behind the uterus. Ultrasound. High-frequency sound waves create images of the inside of the body, which can help identify cysts associated with endometriosis. Magnetic resonance imaging, or MRI. This imaging test provides detailed images of organs and tissues, aiding in the identification of endometrial implants. Laparoscopy. The definitive way to diagnose endometriosis involves a surgical procedure where a camera, called a laparoscope, is inserted into the abdomen to visually inspect for endometrial tissue. A biopsy can confirm the diagnosis. The treatment for endometriosis often involves a combination of medication and surgery, tailored to the individual's symptoms and desire for pregnancy. Medication options include pain relief and hormonal therapies. Over-the-counter painkillers like NSAIDs, such as ibuprofen, can help alleviate pain. Hormonal therapies can reduce or eliminate pain and include birth control pills, GnRH agonists and antagonists, progestin therapy, and aromatase inhibitors. These medications work by reducing or eliminating menstruation, thus limiting the growth of endometrial tissue. Surgery options include conservative surgery and hysterectomy. For those looking to become pregnant, conservative surgery can remove as much endometriosis as possible while preserving the uterus and ovaries. In severe cases, a hysterectomy, which is the removal of the uterus, with or without removal of the ovaries, may be recommended. If infertility is a concern, treatments such as in vitro fertilization or IVF may be considered. Some individuals find relief through alternative therapies like acupuncture, physical therapy, dietary changes, and regular exercise. Endometriosis can lead to several complications, the most significant being infertility. Women with endometriosis may also face an increased risk of ovarian cancer, although this risk is relatively low. Living with endometriosis can be a significant challenge. Chronic pain and other symptoms can affect a woman's quality of life, impacting her physical, emotional, and social well-being. Support groups and counseling can provide emotional support and practical advice. Research into endometriosis continues to evolve, aiming to better understand its causes and develop new treatments. Current studies are exploring genetic factors, hormone regulation, and immune system function. Emerging treatments, such as new hormonal therapies and less invasive surgical techniques, offer hope for better management of the condition in the future. Endometriosis is a complex and often misunderstood condition that affects millions of women worldwide. Increased awareness, timely diagnosis, and effective treatment are crucial in managing this chronic disease. For those living with endometriosis, support and education are vital components in navigating their journey toward better health and well-being. If you or someone you know is struggling with endometriosis, consulting with a healthcare provider and seeking support from specialized organizations can make a significant difference.